Let's discuss something critically important. It's rather interesting that we often fail to prioritize our own health amidst the hustle and bustle of daily life. Today's topic is one such aspect of health that requires our immediate attention: breast cancer. Historically, early detection of breast cancer has shown to significantly improve the chances of successful treatment. However, to detect it early, one must be aware of the symptoms. This brings us to the heart of our discussion today. In this video, we will meticulously go through 10 essential symptoms of breast cancer that you should never ignore. Remember, your knowledge today could be a life-saving decision tomorrow. Stay tuned and enlighten yourself about these symptoms, because when it comes to health, there's nothing more fashionable than being informed. Let's get started, shall we? Understanding the importance of breast cancer awareness can be like finding a flashlight in a dark room. You're suddenly equipped to see what was hidden before. According to the World Health Organization's historical data, breast cancer has been the most common cancer among women worldwide, impacting 2.1 million women each year. It also causes the largest number of cancer-related deaths among women. In 2022, it was estimated that 685,000 women died from breast cancer, which is approximately 15% of all cancer deaths among women. While these figures may seem grim, there's a silver lining. When detected early and if adequate diagnosis and treatment are available, the chance of recovery from breast cancer is significantly high. A study from the American Cancer Society shows that the 5-year relative survival rate for women with stage 0 or stage 1 breast cancer is close to 100%. Now, wouldn't we all prefer to be on the brighter side of these statistics? Knowledge of the symptoms is the first step to early detection, which is why we're here today discussing this very topic. Armed with awareness, we can all be part of the solution rather than mere spectators to the problem. Our first symptom to look out for is changes in breast size or shape. Now, we all know that our bodies change over time and so do our breasts, but this is something more specific. If you notice a sudden or dramatic alteration in either the size or shape of your breast, it may be a reason for concern. According to a retrospective study published in the Breast Journal, among a group of women diagnosed with breast cancer, 17% reported notable changes in breast size or shape as an initial symptom. It's a subtle sign, yet one that plays a pivotal role. So the next time you're standing in front of the mirror, it's worth taking a moment to assess if there are any unusual changes. Be it the size or the shape, if it's not normal for you, it's time to take note. Your mirror might just reflect back something more than your morning hairdo. The key takeaway: be aware and be proactive, because in the journey of life, the road to health is the scenic route. So don't forget to enjoy the view, but keep your eyes open for any bumps along the way. Now, moving on to our next symptom: lumps or thickening in the breast or underarm area. It's interesting to note that this symptom is the proverbial canary in the coal mine when it comes to breast cancer. If you discover a lump or an area that feels different from the rest of your breast tissue, it's time to consult with a healthcare provider. A study published in the New England Journal of Medicine analyzed historical data and found that 83% of women diagnosed with breast cancer had first noticed a lump in their breast or underarm area. While it's true that not all lumps spell cancer, playing the guessing game with your health is about as wise as playing poker blindfolded. So remember, ladies, regular self-examination can serve as an early warning system. It's like having your very own built-in alarm, except instead of an annoying beep, it's a reminder of self-care. If your body were a book, then it's worth learning to read the braille of breast tissue changes. Be vigilant, because when it comes to health, it's better to be a hawk-eyed observer than an ostrich with its head in the sand. Continuing on, let's now delve into the third symptom: nipple discharge that isn't breast milk. Now, as you all know, except for breast milk production during pregnancy and breastfeeding, any other kind of discharge from the nipple can seem rather unusual. Well, your intuition isn't misleading you, as this could be a significant symptom of breast cancer. According to a comprehensive review study conducted in 2010 and published in the American Journal of Medicine, about 5% to 12% of women presenting nipple discharge were found to have breast cancer. This discharge could be clear, bloody, or of another color. It's important to note, though, that while nipple discharge can indeed be a symptom of breast cancer, most instances of nipple discharge are due to benign conditions. Nonetheless, it's a symptom worth investigating further. If the suspense novels have taught us anything, it's that you should always follow the clues, especially when it comes to health. Keep your detective hat on and monitor any changes. An observant eye could make all the difference between the lines of a medical report. We have reached the fourth symptom, changes in the skin of the breast. Now you might wonder, changes? What kind of changes? We are referring to changes that could include puckering, dimpling, redness, or a rash on the skin of your breast that resembles an orange peel. Often disregarded as skin irritation or an allergic reaction, this symptom can sometimes signify a rare but aggressive type of breast cancer known as inflammatory breast cancer. Research published in the Journal of Clinical Oncology in 2005 suggests that among women diagnosed with inflammatory breast cancer, approximately 87% reported skin changes on their breasts as their initial symptom. This study emphasizes the relevance of these seemingly inconsequential skin changes. It's like your skin is sending out an SOS signal, and it's up to us to decode it. So the next time you spot any unusual changes in your breast skin, remember not to brush it off like a forgotten weekend chore. Instead, treat it like a hot new celebrity gossip you can't wait to verify. In the realm of health, you're not just a queen, you're a queen detective, looking out for any abnormalities in her kingdom. Hey, if you are finding this content valuable, do like this video and subscribe to the channel, and while at it, don't forget to check out the description box for valuable resources. Now, let's shift our focus to the fifth symptom, unexplained breast pain. While common and often linked to menstrual cycles, persistent pain, unrelated to your menstrual cycle or centered in one specific area of your breast should warrant attention. You see, according to an Annals of Oncology study in 2004, around 6% of diagnosed breast cancer patients reported experiencing persistent, one-sided breast pain prior to their diagnosis. This type of pain is often described as a sharp, continuous burning sensation. So, the next time you encounter breast pain that seems out of the ordinary, view it as a confidential note from your body, one that's begging to be understood. In this story of your health, you're not just the protagonist, but also the chief investigator, ready to decode any signs your body sends you. Persistent, unexplained breast pain may be an anomaly in the plotline of your health journey, one that should prompt you to seek medical insight. As we navigate the complex narrative of breast cancer, remember, you're the key character, and your attentiveness could steer the storyline towards early detection and successful treatment. Diving into our sixth symptom, let's discuss changes in nipple appearance or sensation. Not the most comfortable conversation topic, I know, but in the context of breast cancer awareness, a highly important one. If your nipple suddenly starts looking different, for example, it becomes inverted, flattened, indented, or shifted in position, it's a sign you should pay attention to. Any new and persistent itch, soreness, or tingling sensation could also be significant. A study published in the Lancet Oncology in 2009 revealed that approximately 7% of women diagnosed with breast cancer reported nipple abnormalities as their initial symptom. While not the most common symptom, it's one you definitely shouldn't ignore. So think of it this way: the next time you're changing, imagine your reflection in the mirror asking, "Is everything okay?" It's a quick check, but one that can make a huge difference. Now, who's ready for a trivia question? It's our halftime show. A quick test to see who's been paying attention. Here it is. What percentage of breast cancers are found in women over the age of 50, according to historical data from the American Cancer Society? Is it A, 30%, B, 50%, or C, 80%? Write your answers in the comments below, and I'll reveal the correct answer later in the video. In the meantime, let's continue our insightful exploration into the symptoms of breast cancer. Moving to the seventh symptom, swelling or redness of the breast isn't something to overlook. While it may seem like typical skin issues or an allergic reaction, these signs play a pivotal role in identifying a rare but aggressive form of breast cancer, inflammatory breast cancer. A retrospective study published in The Lancet in 2005 found that about 90% of women diagnosed with inflammatory breast cancer initially noticed swelling and redness in their breasts. Surprising, isn't it? This reveals the criticality of observing and addressing even the smallest changes in our bodies. Inflammatory breast cancer progresses quite rapidly, often within weeks or months. Timely attention and action are therefore your strongest defense against this fast-paced adversary. Imagine your body as a kingdom and these symptoms as urgent news from a far-off province. Overlooking them could risk the entire kingdom's well-being. In our health journey, no sign is too minor to ignore. With this knowledge in mind, make sure to take any redness or swelling in your breasts seriously, and always share this information with the women around you. After all, health awareness is a community effort, and every member matters. Stay tuned as we delve deeper into the remaining symptoms. When we talk about our eighth symptom, Dimpling on the breast skin, we don't mean those lovely facial dimples that appear with a bright smile. In the realm of breast cancer, dimpling signifies a particular area of skin on the breast appearing indented or puckered, somewhat like the skin of an orange. Regrettably, this critical symptom often goes unnoticed but can be an important early warning sign of breast cancer. Delving into the archives, a study published in the Journal of Women's Health in 2008 revealed that about 2% of women diagnosed with breast cancer initially reported skin dimpling as a symptom. This figure may seem small, but if we translate this to a city of 1 million women, it potentially signifies 20,000 women. An alarmingly large number, don't you think? So let's be vigilant about these subtle changes. It's like playing a game of spot the difference with your health. Remember, the best defense is a good defense. Knowing what to look for can significantly increase your odds of detecting any problems early. Our ninth symptom we're spotlighting today involves the nipple area, specifically an inward pulling of the nipple or pain in that region. According to research published in the Annals of Surgical Oncology in 2006, around 7% of patients with breast cancer identified nipple retraction as their primary symptom. The other aspect to consider here is persistent nipple pain. While it's not as common, it shouldn't be ignored. A European Journal of Cancer study in 2003 reported this as the initial symptom in approximately 6% of breast cancer cases. These statistics underscore the importance of paying attention to even subtle changes in our bodies. Remember, in the context of health, seemingly minor details can sometimes make a major difference. Our 10th and last symptom is easily dismissed as a harmless annoyance or common skin issue. This particular sign is worth noting due to its potential link to breast cancer. Irritation or itchiness of the breast skin is one of those insidious signs that often fly under the radar. When you feel an itch or observe irritation on your breast skin, your first thought might not be cancer. However, according to a research study published in the Journal of Clinical Oncology in 2005, an estimated 5% of women diagnosed with inflammatory breast cancer had skin irritation or itchiness as their initial symptom. This isn't a common symptom like a lump or a change in breast size or shape, but if it persists, it's essential to get it checked out. Before we wrap up, let's get back to our trivia. If you guessed C, 80% for the percentage of breast cancers found in women over the age of 50, then congratulations, you're correct. According to the American Cancer Society's historical data, around 80% of breast cancer cases occur in women aged 50 and older, reminding us that age is a significant risk factor for this disease. Being aware of these critical breast cancer symptoms is vital for early detection, which significantly improves treatment success. Regular self-examinations and medical checkups are the key preventive measures we must all take. Now it's time for you to continue the exploration. We encourage you to tune into our other channel videos to keep expanding your knowledge. Thank you for watching, and we will see you in the next one.